All right, so we'll go ahead and get started. Good evening, everyone. Thank you for joining us for tonight's part 3 of our Medicare 101 4-part series. Hopefully everybody got the email that I sent earlier this afternoon that included the handouts and the slides for tonight's presentation. As always, I will pause during the presentation to see if anybody has any questions. You're welcome to type a question into the chat box at any time and I will address them at the pauses. Or when I do pause for questions, you're welcome to simply unmute and ask your question at that time. We're gonna talk about Medicare Part D tonight. I will try and get you guys out of here as quickly as possible. But again, do not hesitate if you have any questions. And I think that's all the housekeeping I have. So we will go ahead and get started. So again, tonight is part 3 of our 4-part series. And tonight we're going to be talking about Medicare Part D, the prescription drug benefit of Medicare. To start off, I am with the Pikes Peak Area Agency on Aging through the Pikes Peak Area Council of Governments. The mission of the Area Agency on Aging is to provide or work for governments in our 3 county regions to develop and coordinate systems that allow people to remain in their homes for as long as possible. I am with the Area Agency on Aging SHIP program, the State Health Insurance Assistance Program. This is a federally funded program that is specifically and solely designed to provide free and unbiased information and education and one-on-one counseling and assistance for all things Medicare. The SHIP program in the Area Agency on Aging in Colorado Springs actually serves a total of 9 counties in Colorado. Every county and every state should have access to a SHIP program, if nothing else by a statewide toll-free number. On this slide, I have listed both our local Colorado Springs number as well as our statewide toll-free number here in Colorado. If you call that toll-free number, it will ask you what county you're calling from and route you to the SHIP office closest to you. Just a quick note, Medicare is doing an ongoing national survey of beneficiaries and potential or future beneficiaries about the services provided by your local SHIP office. And this survey should be included in an email that you receive in the next 24 hours after this presentation is concluded. We do appreciate any and all survey responses. These survey responses do form the basis for the funding for this program. Because this is a federally funded program, we do not charge for our services. And so again, any responses to these surveys is always greatly appreciated because it keeps this program up and running. Quick review of what we talked about so far in the last couple of weeks. During week 1, we talked about enrolling and eligibility into original Medicare Parts A and B. We talked about what was covered and how much those benefits cost. Last week, we talked about options that you can consider for insurance to go with your original Medicare A and B. We talked about Medigap, also known as Medicare supplements and Medicare Advantage plans and how they work and what they cost. And again, tonight we're going to talk about the newest benefit of Medicare, the prescription drug coverage, Medicare Part D. D stands for drugs. So what is Medicare Part D? Again, it is the prescription benefit of Medicare. It covers only outpatient prescription drugs, meaning it covers the prescriptions that you would go to the pharmacy and pick up. This is actually the newest, biggest benefit of Medicare that went into effect in 2006. Prior to 2006, Medicare did not provide drug coverage, and that was considered an out-of-pocket cost to the beneficiary. Medicare Part D plans do each and every one of them have their own formularies or list of covered medications. But there is a huge range of what must be covered on these lists or formularies. Primarily, if you are looking at purchasing a standalone Part D plan, you will pay a monthly premium. All Part D benefits, regardless of how you receive them, will potentially have an annual deductible and there will always be copays for most drugs. As with other parts of Medicare that we've talked about before, there is potentially some financial assistance for people who are limited or low income. So, should you enroll in Part D? Well, like all parts of Medicare, it is optional. In order to be eligible to enroll in a Medicare Part D, you have to be enrolled in either Medicare Part A or Medicare Part B, or both. Unlike the other parts of Medicare and the other options we talked about last week, you do not have to be enrolled in both parts of Medicare to be eligible to enroll in a Medicare drug plan. Things to take into consideration is whether or not you already have what's considered creditable drug coverage, meaning you already have a drug benefit of some sort that would be considered as good or better than what Medicare Part D can provide as far as benefits. Examples of creditable drug coverage that someone may already have would be, for example, if you are still actively employed and you have health benefits through that employer, that includes a drug benefit. If you are a veteran and you access the VA's pharmacy, that is considered credible drug coverage. If you have credible drug coverage, you don't necessarily need to or want to enroll in a Medicare Part D. And if you delay enrollment into a Medicare Part D in favor of those benefits, if you were to enroll down the road, you would not be penalized for not having enrolled when you first became eligible. Other things to take into consideration is you would certainly want to compare costs. So if you already have creditable drug coverage, that may still not be your best option or most cost-effective option. So you would definitely want to look at comparing the costs of your current coverage to the costs of what a Part D plan would cost you, including premiums and copays. But if you don't have the option of having other creditable drug coverage already when you become eligible for Medicare or eligible for Part D, if you choose not to enroll, there could potentially be penalties if you enroll down the road. And we will talk about all of that in a little more detail as we go. As with all parts of Medicare, there are specific enrollment periods that you do need to be aware of. The initial enrollment period, which is the same enrollment period when you first become eligible for Medicare, which is the 7-month window, the 3 months prior to the month of turning 65 or month of eligibility, the month of and up to 3 months after the month you turn 65 or initial month of eligibility. That is your 7-month window to enroll in anything Medicare without penalty. Above and beyond that, as I mentioned last week, both Medicare Part D standalone plans and Medicare Advantage plans are also subject to the annual election period, or what we typically refer to just as open enrollment. That is the October 15th through December 7th window every fall. And during that time, you are able to get into, get out of, or switch from one Advantage plan or Part D plan to another. Any change you make during that time frame goes into effect automatically on January 1st of the next year. And again, also with all other benefits of Medicare, there are always special enrollment period opportunities in certain situations that would allow you to make changes to this coverage outside of the annual enrollment period or your initial enrollment period based on, again, special circumstances. So, as with Part B of Medicare, if you choose to wait to enroll in a Part D plan, or you choose not to enroll in a Part D plan when you first become eligible, but decide that you need to enroll in a Part D plan in the future, if you didn't have that other creditable coverage in the meantime, you could potentially be penalized, meaning you'll pay more to enroll in those benefits in the future if you did not enroll when first eligible. Even though Medicare does penalize for late enrollment, what it doesn't do is not allow you to enroll. So you'll always be able to enroll in the benefits of Medicare. But again, if you choose not to enroll and you didn't have other coverage in place of that, there could be penalties, meaning you'll pay more. The penalty calculation for Part D plan late enrollment is calculated a little bit differently than the Part B late enrollment penalty. For Part D as in drug, they calculate 1% for every full month that you were not enrolled in a Part D plan or other creditable part or drug coverage. That 1% per month is a cumulative for however many months you went between initial eligibility and actual enrollment. And that whatever that adds up to down the road. So say you wait 2 years, you accumulate a 24% or 24-month penalty. That amount is going to be multiplied by the national average benchmark premium amount. In 2022, that premium amount is $33.37. It would be multiplied by that amount. Whatever that comes out to would be tacked on top of whatever Part D premium for the plan you choose to enroll in is. And that amount would be tacked on to whatever premium you choose to pay every year, even if you change plans from year to year. Like all penalties with Medicare, once you incur a penalty, it's there forever. It never goes away. So that amount would be tacked on top of your premiums forever and ever. And to make it just a little more complicated and a little more interesting, not only will that penalty last forever, but that penalty would change from year to year based on the actual average monthly benchmark premium from year to year. So as that benchmark changes every year, it's still going to be the 24% calculation based on this example, but it's going to be 24% of whatever that benchmark premium is as it changes year to year. So the penalty will change a little bit from year to year. And that's just to make it a little more interesting. Also, as with Part B of Medicare, Part D, as in drug benefits, are subject to means testing, meaning the more you earn in income, the more potentially you could pay in Part D premiums based solely on those earnings. So this is not a penalty. This is just based on your actual annual income. And just like the Part B means testing, it's going to be based on the most complete IRS tax filing that Social Security can access. So the information is typically going to be a year or 2 years old that they're going to base a potential higher monthly premium. Income thresholds are listed on this slide. So anyone who is a single person whose annual income in the last 2 years is $91,000 or less would not have to worry about paying a higher premium based on income. But if your income exceeds that amount, potentially you would pay a higher Part D premium for your drug coverage. Any questions about any of that so far? Again, if you have a question, you can simply type into the chat box, or you're welcome to simply unmute and ask your question.
Yes, I had a question. How restrictive is their formulary?
Well, that really depends. It does vary significantly sometimes from one plan to another. So Part D plans are based on statewide availability. So all the Part D plans that are available in Colorado, and there are approximately 20 of them from a total of maybe 5 companies, and each one of those plans has a slightly different formulary. And we will talk a little bit about how best you would be able to determine what plan gives you the best coverage based on your specific medication needs.
Okay, thank you.
Any other questions? All right. Well, I do have a question in the chat box. How does Part D work with Tricare? Well, that's an easy question to answer. If you are eligible for Tricare and you become enrolled in Medicare, you do have to report that to the DEER's office, obviously. Your Tricare turns into Tricare for Life. Tricare for Life includes a drug benefit, and that drug benefit is considered creditable, meaning it is considered as good as or better than a Part D plan through Medicare. And so you would not need to enroll in Part D. Medicare and Tricare for Life are literally considered some of the best coverage available in this country today. You would not need to enroll in anything else. No supplements, no advantage plans, no Part D. Medicare and Tricare for Life would be all you ever needed. If you were to enroll in a Part D, that Part D plan would become primary to Tricare. It wouldn't necessarily kick you off Tricare, but you wouldn't be able to use the Tricare drug benefit. All right, so how does Part D work? Well, Medicare Part D is based on a formula or basically an outline of coverage. The slide here kind of gives you an idea of what that outline looks like. So basically the way Medicare Part D works is that Medicare has determined that there will be an annual deductible for drug coverage. For 2022, that deductible is up to $480. Once you've met your deductible, and what that means is when you enroll in a Part D, if that plan has a deductible, the first time you go to the pharmacy under that plan, you will have to pay full price for all your medications as often as as required until you spend $480 in retail price out of pocket. Once you've spent $480, you have met your deductible. Next time you go to the pharmacy, you should pay a much lower cost for your medications in the form of a copay. That copay is theoretically going to represent approximately 25% of the retail cost of that medication. So you pay 25% as a copay, the plan pays 75% after deductible. While you're paying your deductible and you're paying your 25% copay after deductible, be aware that the plan that you've enrolled in is taking the full cost of all medications that you've purchased, and they're adding them up in a column over here. And when the full cost of your medications, regardless of what you're paying at the pharmacy, when the full cost of your medications over the course of however long it may take in a given year adds up to $4,330, you will have reached what they call the coverage gap, what used to be known as the donut hole. When Part D first started, if you hit the donut hole, you went back to paying 100% full retail cost for your medications until you reached the other side of the donut hole. Starting in 2012 or 14, Medicare decided to start closing that donut hole or that gap. And so every year between then and 2020, the amount that you paid if you hit that coverage gap or that donut hole went from 100% full retail price, and it was slowly reduced over time until it hit 25% of retail. Once it hit 25% of retail, that's as low as it will ever go. And the government considers that closing the donut hole or closing that coverage gap. However, if you hit that threshold, if your retail costs accumulate to that $4,330 amount, and you hit that coverage gap, you will continue to pay 25% of the retail cost of your generic and brand name drugs. The plan will pay the rest. And once you hit that coverage gap, the plan is still adding up the costs at the pharmacy in this column. So you hit that $4,330 mark. Once you hit the gap, now they're only adding to this column the 25% that you're paying at the pharmacy. If somehow the cost of your drugs at that point continues to add up and you reach a total of $10,012.50 before the end of the calendar year, you would have reached the other side of the donut hole. Obviously, if they're only going to be adding 25% of the cost of that drug when you hit the coverage gap, instead of the full cost of the drugs before you hit the coverage gap, it's going to take you longer to reach the other side of the donut hole. If you do reach the other side of the donut hole, you get into what's called catastrophic coverage. At that point, your costs at the pharmacy would go down to 5% of retail, or a copay of $3.95 or less generic, $9.85 or less brand name for any medication until the end of the calendar year. And then come January, it starts all over. Now, you may be asking yourself, why is there still a coverage gap if you still pay 25% of retail, the same amount you pay during the initial coverage zone? The difference is most Part D plans in Colorado specifically, because I don't know about other states really, but most Part D plans after deductible and during the initial coverage zone do better than the 25% copay. And what I mean by that is there are many plans that will offer $0 or $1 or $2 copay for generics. So instead of paying 25% of retail, you're going to pay a $0 copay, or you're going to pay a $1 or $2 copay. You may pay, a $40 copay for a brand name drug during the initial coverage zone. So even though Medicare requires that these plans at maximum charge you 25% as a copay, plans are allowed to charge you less than 25% during the initial coverage level. Once you hit the coverage gap, then the plans do start charging you actually 25% of the cost. So those $0 copay generics go to 25% of retail. Those $40 brand name copays go to 25% of retail. So that would be the difference between paying the 25% theoretically during the initial coverage zone to actually paying the 25% of retail in the coverage gap, if that makes sense. So again, this is the basic bare bones outline. This is the minimal level of coverage any Part D plan can offer any beneficiary to purchase for Part D coverage. But again, most plans do better than this. Most plans provide better coverage than this bare bones outline. Medicare does require that all plans that provide Part D coverage cover at least 2 medications in every medical class of medication. Plans are allowed to offer more than 2, but they have to offer a minimum of 2 medications in every class of medication. What that means is if there are 20 different medications on the market to treat high cholesterol, a plan only has to choose 2 to put on their formulary list. As long as they offer that minimum 2 prescription option, the plan is meeting the Medicare requirements. Fortunately, most plans do offer more than 1 or 2 options that they're required. And so most plans will offer a number of medications in each class if there are multiple medications to offer. There are 6 classes of medications that all plans are required to offer anything that is available on the market under those classifications. And that includes all antidepressants and antipsychotics, anticonvulsants, antiretrovirals, immunosuppressants, and antineoplastics, which are cancer drugs. Anything available on the market under those 6 classes, every plan must offer every option available out there. Any Part D plan is only allowed to provide coverage for drugs that have been approved by the FDA and are being prescribed for their medically intended purpose. What that means is that if the doctor is wanting to prescribe you Viagra for high blood pressure, because Viagra was not intended or created to treat high blood pressure, Medicare would not cover it to treat that condition. Now that could be a bad example because Viagra is not covered by Medicare at all, but you get the point. If you're being prescribed a medication to treat something that that medication was not created to treat, it is not going to be covered by your Part D. All Part D plans must include all drugs, biologicals, and insulins, including the supplies for injecting insulins. And all plans must include both brand name and generic drugs on their formulary. There are some things that are not going to be covered under Part D, and that is going to include any medications that would have been covered or were covered under both Medicare Part A, again, hospitalization. So any medications you are given while you're inpatient in the hospital are covered under Part A. And then any medications you need that are received in a medical setting. So if you have to go to the doctor's office to receive an injection of a medication, you can't go to the pharmacy and get it and give it to yourself. That would be covered under Part B. Any medication that falls under those benefits would not be covered under Part D. If it's considered an over-the-counter product, meaning it doesn't require a prescription, it's not going to be covered under Part D. Even if it requires a prescription, if it is specifically available to treat anorexia or for fertility purposes or for cosmetic only purposes, it is not going to be covered under Part D. Even if it requires a prescription, if it is specifically and solely used to treat cough and cold symptoms, it is not covered under Part D. Guaifenesin or Robitussin is a perfect example of that, not covered. And then most vitamins and minerals, otherwise known as supplements, are typically not going to be covered under Part D. There are some exceptions to that rule. So if a vitamin or mineral is being prescribed, requires a prescription to treat a specific disease for prenatal purposes, that kind of stuff, it is potentially covered under Part D. But most over-the-counter vitamins and minerals would not be. Any questions about any of that so far? Again, if you have a question, you can simply unmute or type it into the chat box. Okay. So I did mention earlier that there is potentially financial assistance available for people who have low or limited incomes. Financial assistance specifically for Part D benefits of Medicare are actually provided through Social Security. They are referred to as either low income subsidy or extra help. So this assistance is available through Social Security. You apply to Social Security for this benefit. If you are already receiving some types of benefits, you would automatically be eligible and enrolled in this kind of assistance. So if you are receiving Social Security income from SSI, Supplemental Security Income, if you are enrolled in Medicaid for any reason, or if you have applied for and been approved for a Medicare savings program, any of those benefits being received would automatically make someone eligible for the extra help on their Part D coverage. However, you do not have to be receiving those benefits in order to be eligible for help with Part D, because there are several levels of assistance available based on several levels of income and asset eligibility. Again, to apply for this benefit, you can either go to the Social Security website, ssa.gov. You can call the national toll-free number for Social Security, and they should be able to help you with an application over the phone. Or you're always welcome to call us, your local SHIP office, and we are more than happy to help you with an application over the phone. To apply for this assistance is literally less than 10-minute application, because basically you're going to give Social Security permission to access any financial records that you may have so that they can verify income and assets. So it's a very quick and easy application process. And if you do it electronically through their website, you get a response typically in 2 to 3 weeks. If you do a paper application, that response time probably doubles. The income and asset limits are higher to qualify for extra help with Part D than they are for the help with Part B as in boy. So more people should qualify for help with drug coverage than qualify for help with the medical coverage of Medicare. Income and asset limits are shown on the slide here. A single person's maximum gross monthly income, just under $2,000. A couple, just over $2,600. Asset limits are also higher than for help with Part B as in boy. And again, they do not count your primary home, your primary vehicle, your personal possessions. What they do look at, of course, are going to be financial accounts, bank checking and savings, IRAs, stocks, 401ks, that kind of stuff, property you don't live on. For this, for these asset limits, Social Security does automatically include a $1,500 disregard for burial purposes per person. So they assume, and that amount is already added into those total asset limits for burial purposes for each person, and a $20 income disregard for income. Again, we do help with these applications and we're happy to do so. It is a quick, easy process. Even if you qualify for the least amount of assistance because you're at the highest income level, it is still worth applying for this assistance because at the very least, it will reduce or eliminate your monthly premiums. It will reduce your copays at the pharmacy. It will reduce any deductible you may have to pay. And it eliminates the coverage gap so that your costs do not go up to 25% of retail if you hit the coverage gap in your benefits for the year. So again, even if you're at the higher income level or just below it, it is still worth applying for. You would get the least amount of assistance based on those levels, but even the little of assistance, the least amount of assistance is worth applying for and getting because it can save you a lot of money on your prescriptions. For those people who are maybe just over those income limits, not all hope is lost because there still could be potentially some financial assistance available for your medications, especially for any brand name medications you may take. Patient assistance programs are financial assistance programs that are offered directly by the drug makers, the drug manufacturers. The advantage of these programs is that typically they are going to have much higher income limits and much higher asset limits. Most of them will work with people even if you're enrolled in a Part D plan. Typically, they are going to require that you either have hit the donut hole where your costs are going to increase or prove to them that you have spent a certain percentage of your annual income towards the cost of medications. But if you can qualify, and again, eligibility is much broader than under the extra help benefit. If you can qualify, typically you can get a brand name drug at no cost for the rest of the calendar year. So again, if you're just over those income limits for the extra help through Social Security, there may still be hope. There may still be help available through patient assistance. Our office, of course, the SHIP program is more than happy to help you find these programs and see if your specific medications are eligible under any of those programs. I have also listed some of the websites that you can go to look that information up yourself. These websites are typically going to tell you, if you type in a specific medication, it's going to tell you if that medication has a patient assistance program, who that program is managed by, what the eligibility criteria is, and how to apply. Some of the websites even provide the application itself to be downloaded and printed. Again, we're happy to help anybody who is looking at this option. Any questions about any of that so far? Again, if anybody wants to talk about these benefits or their eligibility and perhaps get some assistance in applying, give us a call or shoot me an email. We're happy to talk to you in more detail about these options. All right, so let's talk about how to find a Part D plan. Because as I mentioned, there are 20 standalone just drug coverage Part D plans available in Colorado this year. But that does not include the drug benefits that are available in the 57 Medicare Advantage plan options that are available in El Paso County. So again, each one of those plans, whether it's the 57 Advantage plans or the 20 Part D plans, each one will have a slightly different list of drugs or a slightly different formulary of drugs that they cover. Each plan may have different copays, different deductibles. Standalone plans will all have different premiums as well. So those are all the kinds of things that you need to take into consideration when trying to find the most cost-effective Part D plan for you for the year. Keep in mind, once you enroll in a Part D, that is not the plan you are probably going to keep forever and ever and ever. And that's probably not the plan you want to keep forever and ever and ever. Every year, plans make changes to their premiums. They make changes to their formularies, their copays. During that annual open enrollment period, not only are you given an opportunity to change plans, but it is also the time of year that the plans are given an opportunity to change their benefits. And it does not do anybody any good to stick with the same plan year after year after year and just ignore the whole open enrollment thing. Because as that plan changes, if you're not looking at other options or trying to find your most cost-effective option during open enrollment, before you know it, you could be paying significantly higher premiums, higher copays, or your drugs may no longer be covered from one year to the next. So it absolutely pays and is to your benefit to take advantage of open enrollment every year and look at what options are available for the next year to make sure you are getting the most cost-effective drug coverage every year. How do you do that? Well, you can do that a couple ways. You can call any Part D plan available and ask them directly to go put in all of your medications into their formulary, and they'll be able to tell you what the premiums are, the copays, all of that. You can contact a broker or an agent and have them do that work for you and just present you with the results. Or the most effective way to do this is to use the Medicare website, medicare.gov. On the Medicare website, Medicare has created basically a search engine. And what that search engine allows you to do is it allows you to put in all of your specific medications down to quantities, dosages. You can put in up to 5 preferred pharmacies that you may use. It'll take all of that information, compare it to all the plans available. And the end result is it will list all the plans every year in order of the plan that would save you the most money at the top of the list to the plan that would cost you the most money at the bottom of the list based on your specific needs. It is the most effective way to search through all the plans and find the plan that's going to save you the most money. Let that search engine, let Medicare do the work for you. If you go to Medicare's website, medicare.gov, you do have the ability, and I mentioned this on week 1, you have the ability to create a personalized account. They used to call it a My Medicare account, but I think they've kind of dropped that name. But you can still create a personalized account. The advantages of creating a personalized account is that for Part D purposes, it does save your list of medications from year to year so that you don't have to, during open enrollment, type in all of your medications every year. It saves that. It saves your pharmacy preferences. But in addition to Part D benefits, it also can provide you with real-time viewing of any claims that are being submitted to Medicare on your behalf. You can print temporary Medicare cards if you lose your ID card. It has an electronic health records function that you can give access to your doctors to, and they can upload that information so that you have those records in your account. So there are a lot of benefits to having a My Medicare account. It literally takes just a few minutes to set up that account. It is secure. It is Medicare, so it is secure. You do have to have a Medicare number to create this account. So you can't create an account until you actually have been assigned a Medicare number. But there are benefits to it. It is not required that you would create a Medicare account. It is encouraged, but again, not required. I did provide that handout in week 1 on how to do that. And it's a step-by-step walkthrough of that process. But regardless, you don't need an account to use the plan finder or that search engine on the Medicare website. And I am going to refer to that search engine as the plan finder, the Medicare Part D plan finder, because that's what it was initially called when they first rolled it out. I don't think they call it that anymore, but I've been doing this a long time, so I still call it the Part D plan finder, or plan finder for short. To find that plan finder, if you simply go to medicare.gov, this is a screenshot of the homepage of medicare.gov. There are 2 ways you can get to that plan finder. You can either log in to an account you've already created for yourself, and there's a button right at the top that says log in, create an account. So you can either log in or go ahead and create an account. Or if you decide you don't want to create an account, You go down just a little bit down the screen and you click on the button that says Find Plans. If you click on that button, the next screen you're going to see is Find a Medicare Plan. You can either, again, log in or create your own account. Or in little tiny writing under that button, there's a sentence that says log in without creating an account. And you can click on that button and it'll walk you through the process of inputting all of your medications into that search engine without actually having to create an account. Again, everything is going to be geared towards encouraging you to create an account, but it is not required for this purpose. During open enrollment, that's literally all my office does. That's literally all any SHIP office does across the entire country, is help people access the search engine to look at their options for the next year during open enrollment, both for Part D and Advantage plans. We are happy to do that for anybody at any time. So if you're just becoming eligible for Medicare and you need to know what drug plan is going to best suit you for the rest of this year, we're happy to do that at any time. We're also happy to simply walk you through it so you can do it on your own. However, we can be of help to help you through that search process. We're happy to be of help. Again, and we can do that either over the phone. We can do that by video chat. Our office is currently open to walk-in, or not walk-ins, but to in-person appointments. So you're also welcome to call us or email me to schedule an appointment to do this one-on-one. But again, it is going to be the most effective way to find the most cost-effective plan to enroll in for Part D. Again, it also does Medicare Advantage plan searches. And not only will it give you the drug costs that you would have through any particular Advantage plan, but it will also show you the co-pays for all the other medical services for each Advantage plan as well. So the search engine can provide you with a lot of good information about your plan choices for those two benefits. And we are happy to help. We're happy to answer questions, walk you through it, or simply do it for you and help you interpret the information as the end result. Any questions about any of that? Hopefully I'm not going too fast tonight. This is just focusing on this one topic does not take overly long, but again, questions are welcome. Other resources you can look at for Part D information or Advantage plan information, the Medicare and You Handbook for 2022. Again, the Medicare and You Handbook is going to provide everybody with lots of good information on Medicare benefits and costs and coverage. But if you call 1-800-Medicare and request that they mail you a hard copy of the Medicare and You Handbook for Colorado, in the back of that book, there is going to be a complete listing of all the Part D plans available in Colorado that year, including the premiums, copay ranges, whether or not the plan has a deductible, all of that kind of stuff. So it gives you some good information, but not as detailed. It is also going to list all the Advantage plans available throughout all of Colorado, and it will specify what areas of Colorado most of those plans might be available in. But it will also show you whether or not there's premiums, deductibles, what the copay ranges are for some services, that kind of stuff. Medicare.gov and that search engine is going to be your best tool, but you can also call 1-800-Medicare and they are able to do that search with you over the phone as well. Again, Medicare is available by phone through that toll-free number, 24 hours a day, 7 days a week, 365 days a year. So if you are a night owl and you're up at 1 o'clock in the morning and got nothing better to do, if you pick up the phone and talk to Medicare, someone will answer the phone right away and they'll be happy to help you. During the day, it may take a little bit longer to get through, but they're still going to be happy to help you. As I always mention, our office and the SHIP program is also part of the National Medicare Patrol, Senior Medicare Patrol program, which is the fraud and abuse education program for Medicare. And it helps to educate and empower consumers to protect themselves and how to detect and report potential Medicare fraud or Medicaid fraud and abuse and errors. As with all programs that are government funded, basically, we don't charge for our services. We don't make money off of what we do. So we're always looking for people interested in volunteering. And if you have that interest, you can go to the website, the smpresource.org website for more information. You're welcome to call the SMP hotline for the state of Colorado if you have a concern to report, or if you're interested in volunteer opportunities here locally, you're welcome to give me a call or shoot me an email, and I'm happy to talk about those opportunities here locally.
I have a question. I had a catalog for Cigna medical insurance come in, and it came with a card and everything, and it said that Medicare had enrolled me, which I don't believe.
So if you're just becoming eligible for Medicare,
Yes.
were you covered under Medicaid prior to that?
Medicaid, yes.
Yes, and that is why. So the way Medicare and Social Security work the Part D, the rules say that anybody who has been on Medicaid, regardless for what reason, when they become eligible for Medicare, those beneficiaries will automatically be enrolled in a Part D plan at extra help or with extra help, usually the highest level of extra help that can be received for the rest of that calendar year. So it is absolutely legitimate that you received a card and a handbook for that plan, because that's the plan that Medicare randomly enrolled you in. So you should not have to pay a premium for that plan. There should be no deductible, and you should have really low copays as long as that plan covers your medications. Now, because that enrollment was random out of a handful of plans to choose from, there's no guarantee that your medications are going to be covered by that plan. Again, you're welcome to call us and we'll happily look up your medications to see if they're all covered by that plan. And if they're not, we can absolutely help you enroll into a different plan with those same little or no costs that do cover all your medications.
Gotcha.
Come the end of the year, they're going to review your eligibility for extra help. And if it's determined that you don't actually qualify, then you may not get that level of assistance for next year.
Okay, I don't think that's a worry at this point.
But yeah, I mean, everybody who's been on Medicaid prior to becoming enrolled in Medicare will be automatically given that extra help and potentially automatically enrolled in a plan. And then Social Security won't review your actual eligibility and look at your income and whatnot until the end of that year or the next year. So not everybody continues that help the next year. Some people don't actually qualify, even though they got it the rest of this year. But if you do continue to be eligible, then that extra help would continue. You can change your plan if it's not an appropriate plan, though. You're not stuck with that.
Okay, so I can call up and actually go over this with somebody individually.
Absolutely.
All right, I'll probably set up an appointment for that when this is all over.
You're absolutely welcome to. We're happy to help.
Thank you.
That's about all I have for you guys tonight. Quick, easy, less than an hour class. Were there any other questions? Comments? Again, we're always happy to talk to people one-on-one. You can give us a call. Our local phone number is listed here. You're always welcome to shoot me an email. We do have multiple counselors, so there should always be someone available to answer your questions. Not necessarily going to be able to answer the calls live, but we do return calls as quickly as we can. And we're always happy to talk to you about your specific situation. But if there are no other questions or concerns, again, we appreciate you joining us tonight. Hopefully it was useful. Hopefully I will see you next week for our last week of presentations, part 4 of 4. Next week, we will be talking about other options for coverage to go with Medicare, meaning we're going to talk about Medicare with Medicaid, retirement health benefits, employment benefits if you're actively employed or not, COBRA coverage, Tricare, VA, all of those other kinds of options. We're not going to go into great detail about any of them, just give you kind of an overview of what other options you might have that you may not realize can coordinate with Medicare.
Thank you.
Thank you. And if there are no other questions, I will let you guys go early tonight. I hope you enjoy the rest of this beautiful evening, and I hope to see you next week. Please call us or shoot me an email if you have any questions in the meantime.
Thank you.
Thank you. Have a good night.